Welcome to the deep dive, where we cut through the noise and get straight to the insights. Some animals seem like they were built to survive anything.
Absolutely.
Think of a camel, perfectly adapted for the scorching desert. Or maybe a deer effortlessly navigating a harsh winter. They're incredible examples of resilience, right?
They really are. They sort of embody survival, thriving in environments that would challenge most other species.
And yet, even these remarkably robust animals can harbor a surprising internal metabolic vulnerability. It's kind of internal traffic jam that specifically involves fat accumulating in their liver.
Yeah.
It's a critical breakdown, especially for creatures we think of as, well, the ultimate survivors.
It's a profound thought, isn't it, that even the most finely tuned physiologies have their inherent limits and specific points of failure.
And that's exactly what we're doing a deep dive into today, hepatic lipidosis. You might know it more commonly as fatty liver disease.
Right.
This is a critical metabolic disorder that significantly impacts two quite distinct animal groups. Camelidae, which includes camels, llamas, and alpacas, and Cervidae, so our deer, elk, and moose. Our mission in this deep dive is to unpack the source material you've shared with us, extracting the most important insights, the surprising facts, and the crucial takeaways about why these amazing animals develop this condition, what it actually does to their bodies, and what it ultimately means for their health and survival.
And I think you'll find there are some fascinating universal metabolic processes that actually underpin this disease across different species.
And we'll highlight the sometimes surprising ways different animal physiologies can actually predispose them to this condition. It really can reframe how we view broader health challenges in both captive and wild populations. So let's start with the universal truth. What is hepatic lipidosis?
Okay. So at its core, hepatic lipidosis, or HL, is a metabolic disorder defined by the excessive accumulation of fat, primarily triglycerides, within the liver cells. We call those hepatocytes. But it's much more than just, fat building up. It signifies a state of impaired liver function and cellular dysfunction that, if left unchecked, can unfortunately lead to a complete systemic collapse of the animal.
So when this fat starts building up, what's physically happening inside the liver? How does it actually impact the organ's function?
Well, the fat accumulates as tiny triglyceride-filled sacs, or vacuoles, inside those liver cells. As these vacuoles swell up, they physically enlarge the cells themselves. This swelling can then mechanically compress adjacent structures, critically, including the delicate bile canaliculi.
So little bile tubes.
Exactly. Think of them as tiny drainage pipes for bile. So this blockage of bile flow within the liver is called intrahepatic cholestasis. It's a really key feature of the disease.
So the liver is literally getting clogged, almost choked by its own fat.
Wow. What are the broader consequences when the liver gets into this state?
Well, the consequences are severe. This accumulation of both fats and bile acids within the liver cells actually becomes toxic to those cells.
Right. This triggers a cascade of damaging events, including oxidative stress and inflammation, ultimately leading to cell death, necrosis, and apoptosis.
Okay.
And as this progresses, the liver begins to lose its ability to perform its many critical functions. It can't synthesize essential proteins like albumin or the proteins needed for blood clotting.
So bleeding issues.
Exactly, which can lead to potentially fatal coagulopathies. It struggles to detoxify metabolic wastes, like converting toxic ammonia into urea.
Right.
That ammonia can then build up and affect brain function, leading to a condition called hepatic encephalopathy.
Okay.
And the liver also loses its ability to regulate blood sugar properly and to process other fats and carbohydrates effectively.
It sounds like a total system meltdown waiting to happen. What's the fundamental trigger for all of this? What kicks it off?
The fundamental prerequisite, the absolute starting point for hepatic lipidosis, is a state of negative energy balance, or NB.
NBB.
This simply means the body is burning more energy than it's taking in. And it's most commonly triggered by profound anorexia, a complete loss of appetite, or severe hyperexia, which is just a severely reduced appetite.
Okay, let's unpack this a bit. Walk us through the step-by-step metabolic cascade that leads from, say, not eating enough to this entire liver failure situation. It sounds almost like a survival mechanism gone terribly wrong.
That's a perfect way to put it. It really is. It begins with what we call fat mobilization. So when an animal is in a state of negative energy balance, its blood sugar levels typically drop.
Right.
This drop signals less insulin being released, while counter-regulatory hormones, things like glucagon, cortisol, adrenaline, those stress hormones increase.
Okay.
Now, insulin usually acts as a kind of brake on fat breakdown from stores. So with low insulin and high-stress hormones, an enzyme called hormone-sensitive lipase in the fat cells gets activated.
Got it.
This rapidly breaks down stored triglycerides into glycerol and free fatty acids. We often call them NFAs, non-esterified fatty acids. These NFAs then flood into the bloodstream, becoming readily available for energy.
So the body's desperately trying to get fuel, and it just unleashes all this fat into the blood. What happens when it reaches the liver?
And that brings us to the second crucial step, the liver becoming overwhelmed. The liver is, a powerhouse. It's exceptionally efficient at pulling these circulating fatty acids out of the blood. Under normal conditions, it either burns them for energy through beta oxidation, or it packages them up into very low-density lipoproteins, or VLDLs.
Okay, VLDLs.
Think of these as the liver's fat exporting packages, designed to send fat out to other tissues that need it. However, during severe negative energy balance, the sheer volume of NFAs arriving at the liver can massively exceed the liver's capacity to either burn them or export them efficiently.
So it's like a factory suddenly getting way too many raw materials, more than it can possibly process or ship out. And when it can't handle the influx, that's when the fat starts building up inside the liver itself.
Precisely. That's the final step. Pathologic accumulation. Faced with this overwhelming influx of fatty acids that it can't efficiently burn or export, the liver's kind of default mechanism is to re-esterify them back into triglycerides and store them within its own cells, the hepatocytes. As this process continues, these stored fat droplets, the vacuoles we mentioned, enlarge and accumulate. They physically distend the cells, restarting that cycle of cholestasis, the bile flow blockage, and causing oxidative damage and functional decline.
Wow.
And this creates a really dangerous and self-perpetuating vicious cycle. The liver dysfunction often causes nausea and general malaise, which reinforces the anorexia.
Makes them not want to eat even more.
Exactly, which deepens the negative energy balance, which in turn stimulates even more fat mobilization from the periphery. It's just a tragic loop, pushing the already compromised liver towards complete failure.
That's a truly vicious cycle, where the body's attempt to survive paradoxically becomes fatal. It really sounds like a fundamental metabolic breakdown, so it makes perfect sense that we look to well-studied animals for clues. Why do we look at feline and bovine models, cats and cows, for insights into hepatic lipidosis?
Yeah, that's a great question. Studying HL in domestic cats and dairy cows provides really critical frameworks for understanding its broader principles across different species. They essentially establish two primary archetypes, or models, for how the disease can develop. And these models are incredibly insightful when we try to interpret the disease in camelids and cervids.
Okay, two main models. Let's start in the feline model. What's distinct about hepatic lipidosis in cats?
Okay, so the feline model is primarily what we call an anorexic stress model. Feline hepatic lipidosis, or FHL, is actually the most common liver disease diagnosed in cats.
Really? That common?
Yes, surprisingly common. Its key trigger is acute anorexia, a sudden and complete loss of appetite. And often over a remarkably short period, sometimes just 2 days, maybe up to a week.
Wow, that's fast.
It is, and this anorexia can be due to an underlying illness like inflammatory bowel disease, pancreatitis, diabetes, or even psychological stressors, things as simple as a change in diet or environment that makes the cat stop eating. And a major risk factor is pre-existing obesity. Overweight cats are extremely high risk if they suddenly stop eating for any reason.
And do cats have any unique metabolic quirks that kind of contribute to this predisposition?
They do, actually. Cats have exceptionally high dietary protein requirements compared to many other mammals. They also have relative deficiencies in certain enzymes needed for synthesizing specific amino acids, like arginine.
Okay.
And these factors can impair the formation of those VLDLs, those fat exporting packages from the liver we talked about.
Yeah, so they're not as good at getting the fat out of the liver.
Exactly. It makes them inherently less efficient at clearing accumulating fat from their liver, thus more prone to this buildup. And diagnostically, a hallmark of FHL is a pretty distinct blood work profile. You see a marked elevation in an enzyme called serum alkaline phosphatase, or ALP.
ALP.
With normal or only modestly increased activity of another liver enzyme, gamma-glutamyl transferase, or GGT. That specific pattern is quite suggestive of FHL in cats.
Okay, so that's the anorexic stress model in cats. How does the bovine model, looking at dairy cows, differ?
The bovine model, often called fat cow syndrome, or more formally periprurient hepatic lipidosis in high-producing dairy cows, represents the other archetype, overwhelming physiological demand.
Okay, so demand, not just stress anorexia.
Right. Its key trigger is the extreme physiological energy demand, particularly during what's called the transition period. That's the time right before and immediately after calving.
Ah, for making milk.
Exactly. Primarily for milk synthesis, but also just the metabolic shifts around birth. This demand often far outstrips the cow's ability to consume enough feed energy, causing a profound negative energy balance, even as she's still eating quite a bit.
So it's less about a sudden external stressor causing complete anorexia like in the cat model, and more about the body's own intense internal demands just outstripping supply. And is obesity a factor here too, similar to cats?
Absolutely. Overconditioned or obese, cows at calving are definitely at the highest risk. They simply have larger fat reserves to mobilize when that energy deficit hits.
Makes sense.
And here's a key metabolic peculiarity of ruminants, which includes cattle, but also sheep, goats, and importantly for later, deer. They have a very slow intrinsic rate of hepatic VLDL synthesis and export compared to, say, monogastrics or even cats.
So they're naturally slow at getting fat out of the liver.
Inherently slow, yes. This makes them particularly vulnerable to triglyceride accumulation in the liver when they face that massive influx of fatty acids during that high demand period around calving. So unlike the sometimes acute, unpredictable nature of feline HL, bovine HL is almost a predictable production disease in dairy herds, and it often leads to or is associated with ketosis.
So what's the big takeaway then from these two models when we connect the dots before moving to camelids and cervids?
The big takeaway is that they represent a spectrum of triggers leading to the same fundamental metabolic failure, fat overwhelming the liver. The feline model shows how acute illness and stress can rapidly overwhelm liver metabolism, especially in an obese animal. The bovine model highlights how extreme physiological demand can do the same, particularly in species that have inherent limitations in handling large amounts of fat mobilization due to slow export pathways. Understanding the spectrum is really invaluable for interpreting how the disease manifests in our target groups, the camelids and cervids.
Okay, that sets the stage perfectly. And now what's really fascinating about this next part is how these principles apply to camelids, llamas, alpacas, and camels.
Yeah.
You mentioned hepatic lipidosis is a significant, often fatal liver disease for them. What makes these animals, these pseudoruminants, so susceptible?
Yeah, camelids are a really interesting case. They have truly unique adaptations, obviously. They evolved in arid, nutrient-poor environments and are incredibly efficient at digesting low-quality forage.
Like deserts and mountains.
Exactly. However, this remarkable adaptation comes with a particular metabolic liability, a potential downside. Their distinct endocrine physiology includes lower baseline insulin production compared to many other species, and importantly, a state of relative peripheral insulin resistance.
Insulin resistance, like in type 2 diabetes in humans.
Sort of analogous, yes. While this insulin resistance is actually an advantage for conserving glucose in scarce environments, it means their brake on fat mobilization from body stores, the effect insulin normally has, is less effective.
Ah, okay. So when they do go into negative energy balance, that reduced insulin sensitivity means their fat stores are just relentlessly unleashed. They don't have that same stop signal.
That's exactly it. During negative energy balance, this physiological trait leads to an exaggerated, almost uncontrolled release of free fatty acids into the bloodstream. This flood rapidly overwhelms the liver's processing capacity, much faster and more severely perhaps than in some other species. You could really think of this as a form of metabolic inflectability. Their specialized metabolism, usually a huge advantage, becomes a profound disadvantage in a crisis situation like NEB.
Wow, that's a crucial point. So given that predisposition, what are the key risk factors and what kind of situations actually trigger this catastrophic cascade in camelids?
Well, the development of HL in camelids is typically seen as a multifactorial syndrome, meaning several factors often contribute and interact. As with all species we're discussing, negative energy balance and anorexia are the universal prerequisites.
Always starts there.
Always starts there. And it's often acute in onset. It can even be experimentally induced in healthy llamas just through severe feed restriction over a relatively short time. A key retrospective study looking at clinical camelid HL cases showed that over half had a documented history of severe anorexia or significant weight loss preceding the diagnosis.
That sounds like a very common thread with the feline model, that acute anorexia trigger. What about those high-demand physiological states similar to what we see in dairy cows? Are pregnant or lactating camelids also at higher risk?
Absolutely. That's another major factor. The immense metabolic demands of late gestation and early lactation are major risk factors for HL in female camelids. In that same retrospective study I mentioned, over 54% of the affected females were pregnant at the time of diagnosis, and nearly 46% were lactating, with a significant number being both concurrently.
Wow, huge overlap there.
It really highlights that physiological drain. And similar to both cats and cows, pre-existing obesity is a huge contributing factor. Overconditioned animals are definitely at the highest risk, simply because they have larger fat reserves available to mobilize when triggered. They often present clinically with a history of rapid, substantial weight loss from a previously overweight state, which is the perfect storm for triggering that overwhelming fat release.
And you mentioned stress earlier as a general concept. How specifically does stress factor into the equation for camelids? Is it a direct trigger?
Stress is considered a critical cofactor, absolutely. We know that stress hormones like cortisol and catecholamines adrenaline directly stimulate lipolysis, the breakdown of fat.
Right.
So any significant stressor can exacerbate or even precipitate an HL crisis. We see specific examples like social stress, maybe transport, relocation, introduction to a new herd, losing a companion, or environmental stress. Things like severe heat stress have been associated with outbreaks. And of course, perhaps most commonly, any concurrent disease that causes acute anorexia, pain, or systemic inflammation. Think severe gastrointestinal issues, heavy parasite burdens, bacterial infections like pneumonia can act as that acute trigger, pushing a susceptible, perhaps already overweight or pregnant animal over the edge into HL.
Okay, so it's complex predisposition, physiological state, body condition, and then an acute trigger, often stress or illness. The clinical signs you mentioned sound like they could be quite vague at first, making it hard to catch early.
They often are insidious, yes, meaning they develop gradually and aren't very specific initially. Common non-specific signs include things like anorexia, lethargy, weakness, just a general dull demeanor. These can unfortunately delay diagnosis until the disease is quite advanced and the prognosis is worse.
But presumably there are more specific signs that might emerge as it progresses, things to really watch for.
Yes, definitely. When present, more specific signs would include that history of recent dramatic weight loss we talked about. Icterus or jaundice, that yellow discoloration you might see in the sclera, the whites of the eyes, the gums, or any non-pigmented skin is a sign of liver dysfunction and bile backup.
Okay.
And in lactating females, a sudden, marked decrease in milk production is a big red flag. In advanced severe cases, as the liver fails to detoxify ammonia, we can see those neurologic signs due to hepatic encephalopathy, things like staggering or ataxia, circling, compulsive head pressing against objects, apparent blindness, and even seizures.
That's a terrifying range of severe symptoms. So how do veterinarians typically approach diagnosing hepatic lipidosis in camelids when they suspect it?
Diagnosis really relies on putting together pieces from the history, the clinical signs, and then diagnostic tests. Blood work clinicopathological evaluation is an absolute cornerstone.
What do you typically see in the blood?
You'll characteristically see marked increases in certain liver enzymes. Gamma-glutamyl transferase, GGT, is often dramatically elevated, maybe 2 to even 18 times the upper limit of normal. Aspartate aminotransferase, AST, is usually increased too. And sorbitol dehydrogenase, SDH, which is highly specific for liver cell injury in large animals, is also typically elevated.
So those show liver cell damage or stress. What about indicators of liver function itself? Is it actually working properly?
That's the other key part. A profound increase in serum bile acids is one of the most sensitive indicators that the liver isn't doing its job of clearing them from circulation. We often see levels 10 to even 40 times above the reference range.
Okay.
It really reflects that cholestasis, the impaired bile flow. Low total protein in the blood, particularly low albumin, which is made by the liver, is also a common finding reflecting decreased production.
Okay. And metabolically, what's happening? You mentioned the fat mobilization.
Exactly. Metabolically, you'll consistently find high levels of those non-esterified fatty acids, the NEFAs, and also ketone bodies, particularly beta-hydroxybutyrate, or BHB, indicating the body is desperately breaking down fat. The blood serum itself may even be visibly lipemic, cloudy, or milky due to extremely high triglycerides and cholesterol. And interestingly, blood glucose is often elevated, which seems counterintuitive in a starvation state, but it's thought to be a result of both the stress response hormones and that underlying insulin resistance we discussed earlier. The body isn't utilizing glucose properly.
So blood work gives a really strong, multifaceted clue. What about imaging, like an ultrasound? Can that help?
Yes, diagnostic imaging, specifically abdominal ultrasonography, can provide valuable non-invasive support for the diagnosis. The liver will typically appear enlarged hepatomegaly, and it often shows an increased echogenicity. It looks brighter or more dense on the ultrasound screen, which is consistent with the infiltration of fat vacuoles within the liver cells.
Okay. And for a definitive rock-solid diagnosis, I imagine you need to actually look at the liver tissue itself.
That's correct. A fine needle aspirate of the liver can often be performed relatively easily. Looking at the collected cells under a microscope reveals hepatocytes that are distended by those large, clear cytoplasmic vacuoles filled with lipid.
Got it.
The gold standard, however, for confirmation is a liver biopsy taken from the live animal, or examining the liver at necropsy post-mortem. Histology examining stained tissue sections will confirm moderate to severe diffuse fatty infiltration, usually described as both microvesicular small droplets and macrovesicular large droplets.
And what does the liver look like grossly, say, if an animal unfortunately dies from it?
At necropsy, the gross appearance is usually very characteristic. The liver is typically diffusely enlarged, swollen, and has a pale tan or distinctly yellow color. It's often described as being friable, meaning it tears easily and having a greasy texture on the cut surface. In very severe cases, the liver might be so fatty that pieces of it actually float in the formalin preservative.
Wow, that's dramatic. Given how severe this all sounds, and the poor prognosis you hinted at, what are the therapeutic strategies? It sounds like it must demand pretty intensive care.
It absolutely does. Successful treatment requires prompt recognition, hospitalization, and very intensive supportive care. Nutritional support is the absolute cornerstone of therapy. The primary goal is to reverse the catabolism, stop the fat mobilization, and provide an external source of energy, particularly carbohydrates.
How do you get nutrition into an animal that doesn't want to eat?
That's the challenge. It often means providing nutrition via enteral feeding using nasogastric or orogastric tubes to administer high carbohydrate liquid diets directly into the forestomach or stomach. In very severe cases where they can't tolerate enteral feeding, partial parenteral nutrition, or PPN, might be necessary. That involves providing nutrients like intravenous dextrose and amino acid solutions directly into the bloodstream.
Okay, so nutrition is key. How about trying to stimulate their appetite to get them eating on their own again?
Yes, that's important too. Transfonation can be helpful. That's the administration of forced stomach fluid collected from a healthy donor, often a cow or a healthy herd mate. The idea is that the healthy microbes can help reestablish normal gut function and potentially stimulate appetite. B-complex vitamins are also commonly administered, as they can sometimes help with appetite and are involved in energy metabolism.
And I imagine correcting dehydration and metabolic imbalances is critical too.
Absolutely crucial. Most affected animals are dehydrated and have significant electrolyte imbalances. So, aggressive intravenous fluid therapy is essential to restore hydration and correct things like low potassium or phosphate levels. Supplementing the IV fluids with dextrose is also common to provide readily available energy and help combat ketosis.
And I remember you mentioned insulin plays a key role in the pathophysiology. That lack of braking effect on fat release is giving insulin actually used as part of the treatment.
Yes, the judicious use of exogenous insulin can be a powerful therapeutic tool in some cases, particularly in camelids where that insulin resistance is a factor.
How does it help?
By providing external insulin, you can more directly inhibit hormone-sensitive lipase in the fat tissue, effectively turning off that massive mobilization of free fatty acids that's flooding the liver. This can help halt the progression of the disease at its source.
But that sounds like it could be risky.
It carries a very significant risk, yes. The main danger is inducing iatrogenic hypoglycemia, dangerously low blood sugar. So insulin therapy requires extremely careful administration, often as a constant read infusion, and very intensive monitoring of blood glucose levels, sometimes every hour or two initially, to adjust the dose safely. It's not something undertaken lightly.
Right. So, putting it all together, what's the typical prognosis for camelids that develop hepatic lipidosis, and what's the absolute best approach to prevent it from happening in the first place?
Unfortunately, despite aggressive and intensive therapy, the prognosis for clinical hepatic lipidosis in camelids is often guarded to poor. Mortality rates reported in the literature are high. That one study I mentioned reported that 29 out of 31 affected animals ultimately did not survive or were euthanized.
Wow, that's grim.
It is. However, it's widely believed that early diagnosis and immediate intensive intervention significantly improve the chances of a positive outcome. The earlier you can stop that catabolic spiral and support the liver, the better.
Which really underscores the importance of prevention.
Absolutely. Given the high mortality, the cost and intensity of treatment, prevention is paramount in herd management. This really revolves around careful nutritional management to avoid obesity in the first place, especially in breeding females. Providing supplemental energy strategically for high-risk animals during late gestation and lactation is key, minimizing environmental and social stressors whenever possible. And, crucially, close monitoring of feed intake and body condition score, particularly in those high-risk groups or any animal that seems unwell, allowing for early intervention if appetite drops.
Okay, that paints a clear, if sobering, picture for camelids. Now, this raises an important question you touched on earlier. If hepatic lipidosis is so well-defined and devastating in camelids, what about cervids, our deer, elk, and moose? You said while it's likely clinically important, it seems notably underrepresented in the veterinary literature.
That's right. It seems to be a significant, though often unrecorded or perhaps overlooked, common final pathway of metabolic collapse in many cervid species facing various health challenges.
That's really interesting. So the idea is it's likely significant but not often officially diagnosed or reported. What kind of evidence do we actually have for HL occurring in wild and captive cervid populations?
Well, direct comprehensive documentation is indeed limited compared to domestic species or even camelids. You'll find mentions in pathology conference proceedings or anecdotal reports, but dedicated peer-reviewed case series specifically detailing HL in cervids are scarce.
Why do you think that is?
There are probably several reasons. One is the inherent difficulty in performing timely and detailed post-mortem examinations on wildlife found dead in the field. Decomposition can happen quickly and obscure subtle liver changes. Another is that the diagnostic focus often lands on the primary underlying disease, like chronic wasting disease or severe parasitism, rather than identifying a secondary metabolic consequences like fatty liver, which might be seen as just part of the terminal wasting process.
Okay, so we don't have a huge number of direct, detailed case reports. But is there definitive evidence that severe fatty liver does occur in cervids?
Yes, absolutely. There is definitive proof. A really pivotal study, though it dates back to 1976, documented a condition they termed hepatic fatty cirrhosis, or HFC, in a surprising 25% of wild Texas white-tailed deer examined from a specific wildlife management area known for nutritional stress.
25%, that's high. What do they find?
The gross pathology described livers with irregular, often distinct yellow foci and a firm fibrotic texture suggesting chronicity. Histologically, under the microscope, they found liver cells containing large, confluent fat vacuoles, often distorting the cell shape, accompanied by significant fibrosis, or scarring, of the liver tissue.
So fat and scarring.
Exactly. This report is incredibly important because it confirms unequivocally that severe hepatic lipid accumulation does occur in a wild cervid species, and crucially, that it can progress to a chronic fibrotic stage, indicating a sustained and severe metabolic insult over time, not just an acute event.
That is compelling evidence, even if it's older. What about indirect evidence, maybe from studies looking at why, say, moose populations might be declining?
That's another important line of reasoning. Numerous necropsy-based studies investigating causes of mortality in moose populations, particularly those experiencing declines or high winter losses, consistently report findings of severe emaciation, cachexia, which is that extreme weight loss and muscle wasting, and something called serous atrophy of fat.
Serous atrophy of fat, what's that?
That's when the normal fat stores, particularly in the bone marrow and around the heart muscle, are so depleted that they're replaced by a kind of gelatinous material. It's an unequivocal indicator of a profound and prolonged catabolic state preceding death. The animal has exhausted virtually all its energy reserves.
Okay.
Now, while these reports often attribute the ultimate cause of death to primary factors like heavy tick loads, brainworm, or severe malnutrition, the underlying premortem physiology, this extreme negative energy balance and catabolism, is identical to the conditions that precipitate fatal hepatic lipidosis in other species. So it's highly probable that HL is a major, though perhaps often unrecorded or unrecognized, contributor to mortality in these cachectic moose cases.
Okay, that makes sense. So given that likely occurrence, how do we extrapolate the pathophysiology? Can we apply the ruminant model, like from cattle, directly to cervids? Do they share those same vulnerabilities?
Yes, strongly so. The argument for the significance of HL in cervids is powerfully supported by their classification as true ruminants. They share fundamental digestive anatomy and metabolic physiology with our primary ruminant model for HL domestic cattle.
And the most critical shared trait would be?
The most critical shared trait, based on what we know about ruminant metabolism, is likely that inherently inefficient hepatic VLDL export pathway we discussed in cows.
Right, the slow fat shipping system.
Exactly. This metabolic bottleneck means that, like cattle, cervids are likely predisposed to the accumulation of triglycerides in their liver whenever they are subjected to that massive influx of free fatty acids resulting from peripheral fat mobilization during severe negative energy balance.
So, to put it simply, if a deer or elk goes into a state of ketosis where the body is very heavily burning fat for energy because it has no other choice, that's a really strong indicator that hepatic lipidosis is probably happening concurrently.
That's precisely the thinking. The well-established close association between severe negative energy balance, ketosis, and hepatic lipidosis in dairy cattle provides a direct physiological analog for cervids. Ketosis itself results from the liver being overwhelmed with more fatty acids than it can completely oxidize for energy.
Right.
This same overload, this metabolic traffic jam, leads to the excess fatty acids being repackaged and stored as triglycerides within the liver cells, causing HL. Therefore, any condition that pushes a cervid into a state of severe and prolonged negative energy balance severe enough to cause ketosis would, by the same metabolic logic, put that animal at extremely high risk for developing concurrent and potentially fatal hepatic lipidosis.
Okay, so what are the primary drivers then? What specific conditions are known to induce this kind of severe, prolonged negative energy balance in wild or captive cervids?
There are several well-documented conditions that are prime candidates for triggering HL in cervids. Nutritional stress and outright malnutrition are key, especially in wild populations.
Right, harsh winters.
Exactly. Wild cervids are adapted to seasonal cycles, accumulating significant fat reserves in summer and fall to survive the lame winter months. However, unusually harsh or prolonged winters, poor quality summer range limiting fat deposition, or even overpopulation leading to depleted food resources can exhaust these critical fat reserves, leading to starvation. In the final stages of starvation, after fat is depleted, the body starts breaking down muscle protein for energy, a profound metabolic crisis that inevitably overwhelms the liver's capacity.
And what about major diseases? I imagine something like chronic wasting disease would be a major factor.
Chronic wasting disease, or CWD, absolutely. It's a fatal prion disease affecting many cervid species, deer, elk, moose. Its hallmark clinical sign is progressive, severe wasting over a period of months. This represents a chronic and profound negative energy balance unlike almost anything else. This prolonged, relentless catabolic state is an absolutely ideal trigger for secondary hepatic lipidosis. It's highly plausible that in many terminal CWD cases, the immediate proximate cause of death isn't just the neurological degeneration from the prion, but rather a terminal metabolic collapse precipitated by liver failure resulting from severe chronic lipidosis. The body simply runs out of functional reserves.
That's a really important perspective. Are there other diseases or specific syndromes known in cervids that could also lead to this kind of metabolic spiral?
Yes, definitely. There's a condition sometimes referred to as fading elk syndrome, which has often been linked to heavy parasitism, particularly by the stomach worm Ostratagia spp.
Okay.
This parasite causes what's called a protein-losing gastropathy, severe inflammation, malabsorption, and often profound anorexia, collectively creating a severe, sustained negative energy balance. Similarly, massive infestations with the giant liver fluke, Fascioloides magna, can cause poor body condition, emaciation, and importantly, direct physical damage to the liver, which could compound any metabolic lipidosis.
So parasites are a big one. Any others?
Well, acute systemic diseases that cause fever and anorexia, like epizootic hemorrhagic disease, EHD, could certainly trigger acute NEB and potentially HL, especially if the animal was already compromised. And even capture myopathy, that often fatal metabolic syndrome triggered by extreme stress and physical exertion during capture and handling attempts, can precipitate acute HL. There's actually a case report of this happening in a wild mountain hawk eagle showing that extreme stress and muscle breakdown can acutely overload the liver across species.
It really sounds like hepatic lipidosis could be a major, often silent killer in many of these diverse situations affecting cervids. Just to be clear, are there specific pathological findings beyond that 1976 study that we should look for during a post-mortem exam that might point towards HL?
Well, that 1976 report on hepatic fatty cirrhosis in white-tailed deer really remains the most direct and compelling published evidence, showing those classic end-stage features of fatty liver disease with fibrosis. As we discussed, those moose mortality studies frequently note liver lesions in cachexic animals, which strongly supports HL as a concurrent condition, even if it isn't always specifically named or detailed as hepatic lipidosis.
Why might it not be specifically named?
Sometimes the failure to specifically identify HL might be due to the timing of death or postmortem changes. For instance, a chronically wasting animal may have already metabolized and exhausted most of its body fat reserves before death. In such cases, the liver might appear more atrophic, shrunken, and fibrotic, scarred due to chronic damage, rather than acutely swollen, pale, and greasy like in an acute HL case with abundant fat still present. The fat may have already been burned off or depleted.
That makes sense. So how on earth do we diagnose and manage this in non-domestic species, especially free-ranging wild animals? It sounds incredibly challenging, if not impossible.
It is incredibly challenging. Antemortem diagnosis, that is, diagnosing it definitively in a live animal in free-ranging wild populations, is effectively impossible. The clinical signs, as we've established, are often non-specific. Lethargy, wasting, and difficult to observe closely until the animal is already critically ill or dying.
And you couldn't just capture them to test.
Attempting to capture a wild, sick cervid for diagnostic sampling like blood work or a liver biopsy would induce immense physiological stress. This stress itself could worsen the condition, trigger or exacerbate capture myopathy, and very likely hasten the animal's death. It's usually counterproductive from both a diagnostic and welfare standpoint in a wild setting.
So for captive herds where you have more control, is prevention basically the only viable strategy?
Precisely. For captive cervids, deer farms, research herds, zoo populations management strategies have to be almost purely preventative, focusing intensely on mitigating those primary drivers of severe negative energy balance. Nutritional management is absolutely critical. Meaning ensuring a consistent supply of high-quality, appropriately energy-dense feed, especially during anticipated high-demand periods like late gestation, lactation, or the winter months. Regular body condition scoring by trained personnel is vital to monitor nutritional status and catch problems early. Disease prevention and control are also essential things like robust biosecurity protocols to prevent introduction of diseases like CWD and strategic deworming programs to manage parasite loads.
And stress reduction.
Yes, and finally, stress reduction is key. This involves providing adequate space, maintaining stable social groups to minimize aggression, and utilizing low-stress handling techniques whenever animals need to be moved or examined.
So really the way to think about HL and cervids isn't as some rare standalone disease, but more as a common final metabolic pathway that many different chronic conditions or severe stresses can ultimately lead to.
That's exactly the key takeaway, I believe. It's most likely a critical, though often underappreciated, component of the terminal phase of many different wasting conditions in cervids. The profound and prolonged negative energy balance induced by conditions like CWD, heavy parasitism, chronic malnutrition, or even severe environmental stress creates the perfect metabolic storm for fatty liver development. Given their inherent ruminant physiology, particularly that likely inefficient VLDL export, it's highly probable that the ultimate cause of death in many wasting cervids isn't just the primary disease itself, but the secondary metabolic collapse and multi-organ failure precipitated by a non-functional, lipid-infiltrated, failing liver.
Okay, so what does this all mean when we bring together these two fascinating animal families, the camelids and the cervids? It sounds like both are clearly susceptible to hepatic lipidosis, but for really different underlying reasons, rooted deeply in their unique evolutionary adaptations and physiology.
Exactly. It's a fascinating dichotomy. Their contrasting metabolic responses to negative energy balance really highlight this. Camelids, as pseudo-ruminants adapted to arid environments, seem almost metabolically brittle in this context. Their inherent peripheral insulin resistance, while normally an adaptation for conserving glucose, becomes a profound liability during negative energy balance.
Less so again.
It leads to that exaggerated, almost uncontrolled mobilization of fat from their reserves, resulting in acute, severe hepatic lipidosis relatively quickly. It's fundamentally a disease of acute metabolic decompensation in their case.
And cervids, then, are quite different in how they typically arrive at this state.
Yes, quite different. Cervids, as true ruminants, are physiologically adapted to significant seasonal cycles of fat deposition and mobilization. Building up fat and then using it over winter is a normal part of their survival strategy. Hepatic lipidosis seems to occur in them when this normal process is pushed to a pathological extreme by a deeper, more prolonged, and more severe negative energy balance, typically driven by chronic disease like CWD or prolonged starvation. Their inherent inefficient VLDL export capacity, which they likely share with other ruminants, makes them vulnerable when this extreme state occurs. So in cervids, it's probably best understood as a terminal consequence or component of chronic wasting, rather than an acute primary event like it often appears in camelids.
That distinction between acute metabolic inflexibility in camelids and a terminal event in chronic wasting for cervids is really important. Let's quickly maybe compare and contrast some of the other key differences in their risk factors and triggers, drawing on what we've discussed.
Sure. If we look at the primary metabolic predisposition, in camelids, it's that inherent peripheral insulin resistance, leading to exaggerated lipolysis or fat release. Whereas in cervids, it's likely the inefficient hepatic VLDL export pathway, a characteristic they share with domestic ruminants.
Okay, and key physiological states that are high risk.
For camelids, late gestation and lactation are clearly major risk factors due to the immense energy drain. For cervids, while late gestation is demanding, severe winters imposing high energy demands for thermoregulation on top of maintenance are a critical period that depletes fat reserves.
And how the nutritional triggers themselves.
Yeah, they differ too. In camelids, as we said, it's often triggered by acute anorexia or severe feed restriction, sometimes lasting only a few days to a week. For cervids, it seems more associated with prolonged periods of malnutrition or outright starvation, often stretching over weeks or months due to poor forage availability or chronic disease.
And related to that, the role of body condition.
For camelids, pre-existing obesity is a major risk factor, providing those large fat stores ready for mobilization. For cervids, conversely, it's often poor body condition resulting from chronic wasting, that is the typical precursor state, leading into that terminal phase where HL might develop.
What about common concurrent diseases and environmental factors that precipitate it?
In camelids, almost any disease causing acute anorexia, severe GI disease, infections, pain can be an acute trigger. In cervids, it's more strongly linked to those chronic wasting diseases like CWD or heavy parasitism that cause prolonged NEB. Environmentally, for camelids, acute social or environmental stressors like transport, handling, or heat stress seem to be critical acute triggers. For cervids, it's more about those large-scale environmental conditions like harsh winters, poor range quality, or perhaps capture and handling stress in management situations.
And diagnostically, that leads to big differences in how we approach it, right?
Absolutely. In camelids, ante-mortem diagnosis is definitely feasible and commonly pursued. We look for those markedly elevated liver enzymes like GGT and AST, very high serum bile acids, plus high circulating NAFAs and ketones, and often that paradoxical hyperglycemia. For cervids, especially wild ones, diagnosis is almost exclusively post-mortem, relying on finding the characteristic gross and histological evidence of fatty infiltration in the liver. If blood could be obtained from a sick or dying wild cervid, we would infer, based on ruminant physiology, that we'd likely find similar biochemical abnormalities, elevated liver enzymes, AST, SDH, maybe more than GGT, high bile acids, high NAFAs and ketones, possibly low glucose and terminal starvation, high bilirubin if jaundice was present.
Okay. Clearly, despite what we know, there are still significant knowledge gaps, especially concerning the wild cervid populations. What do you see as the main priorities for future research in this area?
For Cervidae, I think the most pressing need is for systematic investigation into the actual prevalence and significance of HL in common wasting diseases. This really requires incorporating routine, detailed hepatic histopathology, examining liver tissue microscopically into necropsy protocols for cervids found dead or euthanized due to conditions like CWD, malnutrition, or heavy parasitism.
So just making sure we look for it consistently.
Exactly. And ideally, coupling that with metabolic profiling, measuring NEFAs, ketones, etc., in research settings involving captive cervids undergoing experimental infection or nutritional restriction to better characterize their terminal metabolic state. Foundational research is also still needed to definitively characterize the liver's VLDL export capacity in various cervid species to confirm if they truly share that same metabolic bottleneck seen in domestic cattle.
That makes sense for cervids where the picture is less clear. And for camelids, where the clinical syndrome is much better defined, what are the research priorities there?
For camelids, future research could focus more on refining prevention and treatment strategies. This might include investigating the precise molecular mechanisms underlying their insulin resistance to better understand the predisposition and maybe identify targeted interventions. Optimizing therapeutic protocols is also key, for example, establishing more precise guidelines for insulin dosages and infusion rates, or determining the ideal composition of parenteral nutrition solutions specifically tailored to the unique metabolic needs and challenges of camelids with HL.
Okay, so to recap this deep dive then, hepatic lipidosis emerges as a fundamental, final common pathway of metabolic collapse, driven by severe negative energy balance, affecting both Camelidae and Cervidae. However, the context, triggers, and typical progression are distinct. It often presents as an acute metabolic crisis driven by inherent inflexibility in camelids versus appearing more as a terminal event, compounding chronic wasting conditions in cervids.
That's a great summary. And as we've repeatedly seen, prevention through careful nutritional management and stress reduction remains by far the most effective strategy for mitigating this devastating condition in both groups wherever possible.
Which leaves us, and you the listener, with a final thought-provoking question to consider. How does understanding these kinds of specific, sometimes counterintuitive animal physiologies and the hidden metabolic struggles like hepatic lipidosis reshape our view of how environmental changes, habitat degradation, or emerging diseases might impact wildlife populations? What other hidden physiological vulnerabilities or diseases might be silently contributing to the challenges faced by diverse animal populations that we haven't fully recognized or understood yet?